My name is Sabrina McCray, and I attend the Rasmussen campus in Ocala, Florida. This presentation is for Dr. M's Structure and Function of the Human Body. The pathological disease I will be discussing is lupus. First, I want to tell you what lupus is. It's a pathological condition, and it is an autoimmune disease. This means that the body's natural defense system attacks healthy tissue instead of attacking only things like bacteria and viruses. This causes inflammation. Although some people with lupus can have mild symptoms, the disease is lifelong and can become. There are several different types of lupus. There's systematic lupus, discoid lupus, subacute lupus, neonatal lupus, and drug-induced lupus. The effects of lupus is that normally our immune system produces proteins called antibodies that protect the body from these invaders. Autoimmune means your immune system can't tell the difference between these foreign invaders, and your body's healthy tissue create autoantibodies that attack and destroy healthy tissue. These autoantibodies cause inflammation, pain, and damage in various parts of the body. We will now talk about the signs and symptoms of lupus. My daughter was diagnosed at age 13 when a butterfly-shaped rash appeared across the bridge of her nose and cheeks. Most people experience some form of arthritis in their joints. Some people experience painful breathing, shortness of breath, or chest pain. Kidney problems associated with lupus can cause swelling in the legs or high blood pressure. There are some cases when lupus affects the brain and spinal cord, which leads to numbness, tingling in one or more extremities, headaches, seizures, dizziness, vision problems, behavioral changes, even stroke. Other signs could include fatigue, fever, anemia, and even hair loss. This is a visual of the butterfly rash, and in this case we will discuss discoid lupus, which is better known as DLE. This was our first sign when our daughter was diagnosed with discoid lupus. DLE is caused by an autoimmune process involving both B cell and T cell mediated mechanisms that destroy the skin's basal skin. Skin lesions form on the skin, and anyone with DLE should avoid exposure to the sun. Discoid lupus can affect different parts of the skin. It is most common in your facial area, but it can occur on your scalp. These are examples of both. Etiology is defined as the cause or manner of causation of a disease or condition. It is strongly suggested that genes are involved in the development of lupus. Lupus can develop with no family history of lupus. However, there are likely to be other autoimmune diseases in some family members. Certain ethnic groups such as people of African descent, Asian, Hispanic, Native American, Native Hawaiian, or Pacific Island descent have a greater risk of developing lupus, which may be related to genes they have in common. No genes or group of genes have been proven to cause lupus. Researchers don't really know what causes lupus. It is believed that genetic and environmental factors both play a role in the development of lupus. Women are at a greater risk for developing lupus. The disease occurs 10 times more often in women than in men, and women of color are more likely to develop lupus than white women. Most people are diagnosed with lupus between the ages of 15 and 44, but children and older adults can also develop the condition. These are pictures of an actual woman with discoid lupus, and these are actual pictures of children with discoid lupus. Men are rarely affected with lupus, but here are 2 celebrities that were diagnosed with discoid lupus. Systematic lupus is another form of lupus, and to be diagnosed with systematic lupus, you have to have 4 or more of the following criteria. For example, the butterfly rash, scaly discoid skin lesions, psychosis or seizures without a clear cause, or cellular casts in the urine, just to name a few. Systematic lupus is the most common form of a lupus. Here are some examples of how cells are attacked. Here you have the type 1, type 2, type 3, and type 4. The organs that can be affected by lupus are your kidneys, lungs, heart, and your brain. Your heart can be affected because you can have heart disease, heart attack, or you have heart cancer. Your kidneys, you can develop kidney failure or infections in your kidney. Your brain consists of high blood pressure, memory problems, behavior changes, hallucinations, seizures, strokes, and even cancer in the brain also. Your lungs can be affected by lung pleurisy, which is inflammation of the chest cavity lining, or pneumonia. Here's a picture of that also. Another form of lupus is called subacute cutaneous lupus, which causes skin sores on areas of the body exposed to the sun. Here's an example. This same form of lupus can also cause sores in the mouth and around the mouth. Neonatal lupus is not true lupus. It is a rare condition that is sometimes contacted by antibodies from the mother that affect the fetus at birth, and the baby may have a skin rash, liver problems, or low blood cells count, but these symptoms typically disappear completely after 6 months with no lasting effect. The most serious symptom is congenital heart block, which causes a slow heartbeat. This is usually detected when the fetus is between 18 and 24 weeks old. This does not disappear, and affected infants will eventually need a pacemaker. Drug-induced lupus can be caused by certain medicines. Certain medicines can cause temporary symptoms and signs of lupus. The symptoms go away when you stop taking the medicine, typically within a few weeks. Symptoms are usually milder than in typical lupus, and the kidneys and central nervous system are rarely infected. Here are some medicines that may play a role in inducing lupus. Treatments for lupus include the hormone DHEA, listed here, may be helpful for the treatment of lupus. Your body uses DHEA as the starting material for making the sex hormone testosterone and estrogen. The herb alfalfa, which can worsen SLE or bring it out of remission, should be avoided completely by anyone with SLE. In my conclusion, there is no known cure for lupus, and coping with lupus can be stressful. Relaxation techniques such as meditation and yoga and finding support groups may be helpful.